Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
Hi there. Welcome to the 87th episode of A Couple Takes on MS. Hi, this is Dan Digman.
And hi, it's me, Jennifer Digman.
Welcome to our show where we take the perspectives of two different people living with multiple sclerosis. I have had MS for over 20 years and am living with relapsing remitting MS.
And as you may remember, I have been living with multiple sclerosis for almost 22 years, and my disease has progressed to secondary progressive MS, and I'm no longer walking, and I'm in a wheelchair. So Dan and I think we have two very interesting perspectives and takes on multiple sclerosis.
And by the way, we are husband and wife. So
yes, we just celebrated our 14th anniversary.
14 years.
14 years.
That's
a long time, a long good time.
Yeah, it the time flies.
Time flies,
Right.
and if you are newly diagnosed and listening to our radio show for the first time, or even if you're listening and been diagnosed for a while, especially if you're newly diagnosed, so the point is time flies. And right now you may be like, your world is rocked because you've just been diagnosed with MS. But give yourself time, it'll get better because time flies. Sorry, Dan, I just had to insert that plug.
Absolutely, time does fly, and I think that what we're talking about today is the MS appointment aftermath. Last time we had talked about I was going to a new neurologist. I mean, it's the first neurologist I've seen, or the only different neurologist. I've had the same neurologist since I was diagnosed back in 2000, and he retired in 2017, and then it took me a while to get all the paperwork and everything set to go and see a new neurologist who happens to also be the neurologist that my lovely wife of 14 years, Jennifer, sees. And we had talked about just how you prep or what's there, the anxieties that come with seeing a new neurologist. But we're here this time and we talk about the aftermath. And so it's just like, when we talk about what it is you're looking for when you go to see your neurologist, and especially with a new one, what are you hoping to get out of the said appointment, and where do you go following, and what makes it a good appointment, a bad appointment, and just talking about here with you just ways to really analyze that and just find the benefits and the next steps really after you have your neurologist appointment.
And I think aftermath has a little bit of a pejorative term, like, oh my gosh, your appointment must have gone horribly bad or something. But the aftermath is you leave doctor's office, you have that 2.5 hour drive home to just think about everything you talked about and all the changes that the doctor encouraged her, even if she didn't, just the changes that you want to make. So in a certain way, you were talking about time flying and the reality that it had been almost 2 years since you had seen a doctor, and now you see a doctor, and there is a little aftermath, just little changes that you have to make. So I think while it was a really good visit, for me as your caregiver and your spouse, it was a different kind of way of handling it, because I got to sit in, be a fly on the wall for your neurological visit. But do you think it went well?
I think it went incredibly well, and I think that's where, let me just interject here then, as you talked about I don't want to say negative connotation of the word aftermath, but indeed, it should have said more like MS follow-up, because aftermath is a negative kind of word, because according to dictionary.com, aftermath is something that results or follows from an event, especially one of a disastrous or unfortunate nature.
Well, I think a lot of people, interesting, would say that multiple sclerosis is a disaster and an unfortunate nature.
And thereby then that's why I don't think that it was necessarily an inaccurate word to use, because MS is just the diagnosis, everything thereafter is an aftermath of sorts. But my appointment on Monday morning with Dr. Braley is my neurologist down at the U of M hospitals.
That's the University of Michigan.
University of Michigan,
In
indeed.
case y'all didn't know, we're in the middle of the mitten. That's Michigan. And Dan and I go down to Ann Arbor to see our neurologist.
It was, I dare say, and you were there to witness everything. Just that at one point I was that close to tears.
You literally, I could see them welling up in your eyes.
I think that,
and you've been living with this disease once again for 20 years. It's just surprising that your first visit to my neurologist, you were on the verge of tears.
And I think this is where, we always talk about when you're living with multiple sclerosis, to be your own best advocate, to talk about things, and maybe this is where I need to be a better patient, to look at things, but you know me, and I don't overreact to things.
I'm nodding my head. He does not overreact.
It takes a lot.
But you also are very stoic, and I don't want to say that's a man thing. But any of you female listeners out there who have husbands as caregivers or the spouse living with multiple sclerosis, men kind of keep things close to their chest, so...
It was, I'm thinking of sometimes there's things, we talk, we know, we do stuff with multiple sclerosis, and I think that if I'm functioning and doing, then my MS is fine. Never did I think something that was that was quote unquote wrong with me was normal, or not. It was not an uncommon thing for somebody with MS to have.
Yes. And that's where I think it does us as a couple a little disservice, because you're walking and I'm the one that needs the mobility aid, and so people naturally think, well, Dan's fine. And Dan may sometimes himself naturally think he's fine. But when we were laying in bed, this is going to get steamy. Just kidding. We were laying in bed. I think this is where you're going.
This is where I'm going.
The other night, maybe a few weeks ago, and I just said, Dan, can't you ever relax? Because he was like twitchy. I don't know if any of you have spouses or sleeping partners that just fidget a lot. And I just said, my poor baby, you just can't relax.
And I feel that's something where, because you had commented, and this is where I need to pay more attention, but I don't overreact, and I don't want to be a hypochondriac on things, and so I guess maybe I sway too far the other way when it comes to dealing with or recognizing things, because you had commented that I probably don't get good sleep, and I always, and I love my mother, but I always blamed my mom, because my mom is such a light sleeper. I'm saying, well, that's because my mom's a light sleeper and I inherited her genes, blah blah blah. And so because we get sleep at night, and those nights, even when we would get, consciously on a weekend and get like 10 hours of sleep, mm-hmm. and I wake up and I'm still not rested. And so it was you who commented and stuff to say something to Dr. Braley about like not sleeping. And to be point blank honest, and I hate to do this and say it on the air, never really commenting to you about it, I truly didn't. My first reaction was, I don't think this is a neurological issue. I do
That's
not think that. I
interesting.
do not think that my fidgetiness and lack of sleeping well is MS related.
And I hear you on that. And part of the reason, because Dr. Braley has been my doctor for so long, I've known she's always been really interested in sleep and multiple sclerosis. So I would ask Dan periodically when he's yawning in the morning, does your sleep, is it recuperative? You know, when you go to bed at night, do you wake up feeling refreshed? And seldom did you say you did. And you always credited coffee and caffeine for keeping you going, which I was like, that's insane. But, you know, we've been married for 14 years, and if that's what keeps you going, that's what keeps you going. But when you were twitchy, I was just like, man, that's just, poor baby. He just never can relax.
And so with this, and this is where it gets like serious, is, well, not that we weren't serious, but it's like in talking with Dr. Braley, and I commented about basically everything we just shared with you in Listenerland, and it just, she said, I think you have restless leg syndrome. And I know that that's something that Jennifer, you had commented on, years ago, that you thought maybe you did, or you were hoping you had restless leg syndrome.
And I don't. It was just spasticity. That's my little asterisk. But Dan, he just can't stay still. And then when I was asking you about it, you explained it that it's not that you want to move, it's just like you can't keep your legs from moving, or you feel that
it's
you
like
have
you consciously have to move, and that's where I was. Dr. Braley almost moved me to tears, because I tell her about this, and she says, I think it sounds like you have restless leg syndrome, and she starts describing it in that. I always thought that restless leg and like was with you, and like it was a muscle, an involuntary spasm. But Dr. Braley is talking like with less restless leg syndrome. You feel the need. You have to kick your legs. You have to move your legs. You have to shift, and that's exactly how I was. I would get into bed, and I'm just like kicking my legs around. I'm doing this, and you had said, and we're not exposing TMI. I mean, these are just realities. I mean, we go to bed. I don't cuddle up to you right away. I was laying in bed because I needed to kick my legs and just get the leg kicking out of the way. And so then Dr. Braley says how it's something that, yeah, I'm doing it. I just feel that I have to do it. And she said that with the restless leg syndrome like that, she said that it's not it's not like a regular thing, but it's not uncommon for people who have multiple sclerosis to have restless leg syndrome, especially those who have lesions in their C-spine. And she said, and that's where you have a lot of your lesions, is in my C-spine.
And that was the point when Dan's eyes started welling, like, oh my goodness, this could be not something of my imagination. This is a legitimate problem, something that can be fixed. Well, at least that was your next question to her, is like, can you do something about this?
And to which then she talked about options, but she said what she would recommend, and what she did was prescribe. And again, we're not paid drug.
Yeah, we're not advocating or recommending
drugs
or
and
anything.
things, but Neurontin that and I'm like, I'm game for anything. And so then we get the prescription, and then then we look at things, and then I'm freaked out with the side effects, or at least concerned, because when they talk about being groggy, drowsy and stuff, and I'm thinking, I have so much work I have to do at work that I can't afford to be drowsy. and everything. And it's like I told Jennifer, I would rather, it's easier for me to put up with the tiredness of not sleeping than it is to go through the fog of being drowsy from side effects of medications. And, but for whatever reason, I just that night I said, I'm going to give it a try.
Because I think possibly we had that 2.5 hour drive home, and we talked about the changes that we were going to make after seeing the doctor and how we wanted to feel better and make a new stab at being healthy, taking better care of our health. So that night, come 9 o'clock, Dan went and got his medicine, and he said, I'm going to do this.
And just cutting to the chase, I mean, I woke up the next day and I had never felt that rested. I mean, we went to bed, and that's, I guess we'll go to another thing that was learned with Dr. Braley is, it's the reality, we don't sleep enough. I mean,
we being Dan and I, but I think Americans in general don't get enough sleep.
No, and we're too dependent on TV, our social, our cell phones, social media, and everything. And we, Jennifer and I, made this little discussion. I mean, and think how you are out there in listener land. I mean, just like how you use your cell phones, how you use social media and watching TV and doing things like this, and just, I wasn't letting my brain shut down.
And Dr. Braley had talked about the fact that we needed to get at least 8 hours of sleep at night. And that's difficult for everyone, but in addition to that, you need to turn your cell phones and your television off, like maybe an hour before you go to sleep so you can wind down. Which I think was really important for both Dan and I, because let's be honest, we are on our cell phones, we're playing with social media, we're playing games on our phones or something. So this was in that attempt to make us get that restorative, recuperative sleep. So you took your medicine.
Took the medicine, and we made the conscious decision that 10:30 is bedtime. I mean, because we were getting, at best, 5 to 6 hours of sleep at night.
And if we are striving for the 8 hours that she encouraged, we're going to go to bed at 10:30, we're going to get up at 6:30. And you don't just do it for like 2 days, you do it consistently for a few weeks, I believe she said.
And you do it like for every day, including weekends. You don't
Yes.
sleep in on the weekends because you want to get your body synced up. And obviously, for anybody who practices regular sleeping and stuff, you're like, well, duh.
But for Dan and Jennifer, we were like, oh, that's huge.
So we can't stay up binge watching during the week and staying up seeing Nurse Jackie and getting into this or football.
I mean, if we wanted to feel better, we had to try and go to sleep at the same time every day and wake up at the same time every day. And not snooze your alarm clock 4 or 5 times. Like, get your lazy buns out of bed. And so we can't be like patting ourselves on the back like, oh, we're superstars. But we are doing that, and we're trying to be conscious. And so I think that was something really good that came out of the visit, because sleep is pretty darn important.
Well, especially for people with MS that are dealing with fatigue issues. And I think that's where I was doing myself a disservice, because I wasn't getting the sleep. And what I would do is I'd continue to drink coffee during the afternoon work and stuff, just to keep myself alert and awake and things. Well, that being said, then if I stopped drinking coffee at 5 o'clock at night, I had enough caffeine in me from the day that I'm not going to be ready for bed at 11 o'clock, 12 o'clock.
Yeah, that's a good point.
And so that was I think it's just a huge lesson learned, and that's where we need to be more mindful and mature, responsible.
Potentially, those are good words.
Yeah.
And I think this sleep it ties into something you said before you had your visit to the neurologist. You encouraged everyone to be honest, and as we were sitting and Doctor finishes her evaluation with you, and she said, anything else? And then Dan, in his best way, he just said, oh, but I have this, sleeping, twitching thing. And that was kind of, near the end of the visit.
I was going to say, and that was I want to say like the afterthought, because, we had started, because with a new neurologist, I guess my fear was, with disease modifying therapies, obviously that's a big thing that you discuss with your neurologist. She, being me being an established person with multiple sclerosis, I did not know if she was going to have wild ideas about putting me on some sort of different disease modifying therapy. And again, we're not, drug spokespeople and, paid advertising. No, but I mean, we've been honest about this. I've pretty much been on beta-seron for my entire 20 years of living with multiple sclerosis. And obviously, then too, it is the oldest of the approved
Oldie and goodie.
oldie but goodie. The original of the ABC drugs have an X beta serin Copaxone. But it's a shot, and think now we've got
It's an injectable medication.
Yeah, it's not.
Well, no, I wasn't saying that to be snotty. I'm just
Yeah.
for people who are newly diagnosed
Yes,
or not
it's
familiar.
injectable. I mean, and stuff. Whereas now, a lot of the medicine, the DMTs are oral or infusion every 6 months, whatever. But and this is where when you're talking about a new neurologist and finding the best neurologist, you want to find somebody that empowers you and takes your opinions, your information, your feelings to heart. And so when I was talking with her and her assistant, Dr. Jordan,
Yes.
I didn't. Jennifer and I have talked about changing, or not like seriously changing, but when you think you've been on the same drug for 20 years, and I mean, I'm running out of places to shoot myself.
Which is kind of an adverse reaction or a side effect of taking an injection every other day and not having a large amount of sub-Q fat. You're going to run out of injection sites, and to be honest, you may think, oh, I want to try something new. But Dr. Braley and Dr. Jordan, they were both very honest and respectful of how your life is. That this is working for you. You have a job. You are my caregiver. You have to take care of yourself. And maybe some of the new medications just aren't for you yet. So I think she really listened to you, and she was very much, if it ain't broke, don't fix it.
And that's what I appreciated, was just listening to my thoughts, my opinions, because she was like, this is, it's up to you. If you want something, if you want to try something new, I fully support. But if you're fine, I'm fine. But what I liked about it too was I asked the question, like, I don't want to change. However, as Jennifer and I continue to have these discussions, at least to be cognizant of what else is out there, just that she was very open and honest when I said, what would you recommend? And I just that she wasn't like shy about saying what drugs she would recommend and why she would recommend it.
And at the same token, she wasn't shy about saying what some of the side effects were of that medication, how her interactions have been with other MS medication. And so I think that honesty, not only were you honest with your neurologist, but your neurologists were honest with you. And I think that's the foundation of a really good relationship, just having that honesty.
And I think something that, and I encourage, I'm sure I'm speaking for Jennifer too, when you go to your neurologist, it's a question of, do you go by yourself or do you have someone with you when you go? And I'm sitting here right now, and I'm recommending take somebody with you. This was the first time Jennifer had ever been with me to a neurologist appointment, because I always went to my other doctor by myself. And I think, make plans, whether it's your spouse, your best friend, your mom, your dad, brother, sister, whoever, and always talk to them before the meeting, before the appointment, to say, these are the questions I'm going to have. Because then when the meeting comes to an end, or when you're talking about things, obviously even if we write our questions down on a sheet of paper, sometimes we miss them or we skip them and stuff. And that's where you were so good with having you in there that you could like flesh out the questions I was asking or expand on things.
Thank you, but I've watched you as my caregiver. You've always gone with me to my doctor appointments for the 14 years of our marriage. So I see how you do it. And I think it's important as a caregiver and a spouse or a loved one. And I'm the talkative one, let's face it, to those of you out there in listener land. You realize I'm the chatty Cathy of the group. But I kind of had to sit and let the doctor and Dan discuss and do everything. And then there comes a point, like a lull in the conversation, where I was able to say, oh, but what about this? And, Dan appreciated that, and I appreciated him letting me open up to that and just to kind of be a fly on the wall. It was a really good experience.
Well, I think that's the important thing. Then, if as a caregiver, when you go, if you are the caregiver on these things, always make sure that it doesn't become your show. It's really, I think, if I can use, as I always do, like a sports analogy, I think when you go to these kinds of appointments, me as the person living with the disease, it was my show. I was the play-by-play announcer. You were the color. You brought in the color. You provided the perspectives, and so I think that's a big thing, and that's where I appreciate and thank you, because I don't think any of this unveiling of the these developments in my dealing with my MS would have come to light had it not been for sharing this with another person.
And that's why we recommend to do that, and I'm very thankful again that you were able to share it with me, and I'm hopeful that in the future this appointment relationship, they will continue to be wonderful.
And so with this, when you go, be honest with your neurologist and analyze things afterwards. Make sure you're on the right track with anything in your treatments. So thank you all again for taking the time to listen to us. This has been A Couple Takes on MS with Dan and Jennifer Digman. Thanks to the Blue Draft Kid for composing the theme music for our show. And thanks to the MS&Me Radio Network for having us. Reach us online. Our website's danandjenniferdigman.com or on Twitter @DanJenDig. Take care.